Hi, I'm Dr. Glenn Corneal, Acting Medical Officer of Health for the Timiskaming Health Unit. Today, I'm going to address some of the questions we are hearing about COVID-19 vaccines. This is such an important topic, as COVID-19 vaccination is what is going to allow us to control this pandemic. Vaccination is extremely safe and it works. It will not only protect you, but also your loved ones, your co-workers, and those around you. Getting your vaccine greatly reduces your chances of becoming seriously ill, being hospitalized, or dying from COVID-19. The first question is, do the COVID-19 vaccines work? The 4 vaccines approved for use in Canada are the Moderna and Pfizer mRNA vaccines and the AstraZeneca and Janssen viral vector vaccines. All 4 vaccines are highly effective and are performing very well. For example, Ontario saw a huge drop in the number of outbreaks in long-term care homes after the first dose campaign. For long-term protection, a second booster dose is needed for the Pfizer, Moderna, and AstraZeneca vaccines. One common question at our clinics is, will the vaccine give me instant protection after the first dose? While the vaccines are very effective, it takes about 2 weeks for your immune system to develop protection. For this reason, and because many people have yet to receive their vaccine, it is very important that we keep following public health measures after vaccination. Wear your mask, practice physical distancing, and wash your hands often. People want to know, can I still get COVID-19 if I've been vaccinated? The vaccines greatly reduce the chance of getting COVID-19. Like we see with other vaccines, some people can still get COVID after vaccination. If this happens, the symptoms are usually much milder, and the chance of needing to be admitted to the ICU or dying from COVID is essentially eliminated. If enough people receive the vaccine, we will reduce its circulation in the community. This is what we call herd immunity, and this is why we really need everyone to get vaccinated. One question that we hear a lot is, what are the common side effects of the COVID-19 vaccine? Many people don't experience any side effects. The most common side effect is soreness at the injection site. Less common are other symptoms like headache, fatigue, muscle and joint pain, chills, and fever, which can last for a few hours or a day or 2. Side effects are usually a sign that the body is working to develop immunity to COVID. A delayed side effect that we sometimes see is a red mark at the injection site developing about a week after the injection. This side effect is harmless and it is not an allergic reaction. If you do develop any of these side effects, you can still safely receive your second booster dose. If you are not sure if you have had a more serious or allergic reaction to your vaccination, please review your symptoms with your primary care provider. We follow adverse events following immunization very seriously and very closely. Now, for those who received AstraZeneca as your first dose, you absolutely made the right decision. The government has just recently put a hold on more people getting a first dose of this vaccine due to the rare clotting disorder now called VIT, because Ontario started to see rates around 1 in 55,000 people. So far, based on evidence out of England, it looks like this clotting issue is extremely rare after a second dose, with at present an estimated rate of 1 in 1 million people. We are waiting for the province's recommendation for second dosing for this AstraZeneca population, and this should arrive shortly. Some people want to know, can COVID-19 vaccines cause COVID-19 virus infection or infertility? No, none of the vaccines can make you sick with COVID-19 as they do not contain the live COVID-19 virus. Also, it is not at all possible for the vaccines to alter your DNA or somehow affect a person's fertility. With each dose given, we are one step closer to wider community protection and nearing the end of the pandemic. Already, over 50% of our age 16 plus population have received at least 1 dose. We hope you will book your vaccine appointment as soon as you are eligible via the Ontario online booking tool. If you are having trouble with booking, please contact the Timiskaming Health Unit. Until enough people are immunized against COVID-19, we still must respect all public health guidelines to protect ourselves and others. Even for those who have received a vaccine, it is essential that you follow these measures, and especially, please avoid social gatherings. If you have not received your vaccine yet, your turn is coming very soon. Watch for announcements as more groups become eligible. And if you have questions, visit timiskaminghu.com or speak to your healthcare provider. Thank you for all you have done to keep the rate of COVID-19 in Timiskaming low. Thank you as well to everyone who has started to get vaccinated and for doing your part in protecting our district, as we are all truly in this together.